Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, treatment of intracranial pressure in a case with meningitis. In meningitis, there is raised intracranial pressure is seen. So we have to treat this raised intracranial pressure which is seen in meningitis. Raised intracranial pressure can be treated by elevation of head to 30 to 45 degrees, by elevation of head to the 30 to 45 degrees, or you can give hyperventilation can be given to the patient, and mannitol can be used to decrease the intracranial pressure in meningitis.
thank you and thank you for watching.